Assalamu alaikum and hello everyone. This is Dr. Alenazy. I am one of the intensivists at Prince Sultan Military Medical City. We'll talk in this video about the central venous accesses uh, as a part of the Intensive Care Services COVID disaster plan directed to the non-ICU trained physicians. Okay, and let's go with our objectives. Uh, First, we will discuss the types of central lines and then the indications, the site of insertion, the technique of inserting a central line, and the post-placement care of a central line. We have numerous classifications depending on the duration, number of lumens, catheter diameter, and if the catheter is tunneled or non-tunneled. And to make it simple, most of the catheter that we are using in ICU are short term, and usually they are uh, double or triple lumens. The one point on the catheter diameter, these sizes are in a French, and to convert it to a millimeter, you just need to divide that number over 3. For example, if you have a size 7 French divided by 3, you will have an approximate of 2.4 millimeter. That will be the diameter of that catheter in millimeters. Okay, and here we have different types of central lines. At the right side of the screen, these are the dialysis catheter. These has a larger diameter. When you compare it to the left side of the screen, which is the usual commonly used in ICU, the triple and the double lumen central lines. For the tunneled catheter, usually we don't see them in ICU. These are catheter that are usually done for a patient who is on chemotherapy or who is receiving a hemodialysis. The difference between the tunneled and the non-tunneled, the tunneled, they are underneath the skin to minimize the risk of the infection because they are long-term catheters. Okay, the indications of the central line in ICU. When you have a difficult peripheral access or when you need to deliver a vasopressors or TPN, or if you need to deliver a prolonged parenteral drug therapy. Other indications including the hemodialysis, transvenous pacing, and the hemodynamic monitoring. Sorry. We'll mention quickly about the contraindications, which includes a thrombosed vein. When you assess your vein with the ultrasound and you find a thrombus, then it's better to look for another site of insertion. The second, if we have an inflamed or burn area at the site of insertion, then it is not wise to go through that vein. Other indications sometimes can be considered as a relative contraindications when you have a platelets less than 20,000 or INR of more than 3. Okay, the site of insertion. We have 3 different sites to insert a central line. I will start with the subclavian, but I am not going in detail with this site because it needs more practice and more experience. The other 2 common sites for insertion are the internal jugular vein and the femoral vein. In this photo, I want you to concentrate more on the relation of the vein and its adjacent structures. The internal jugular vein, as you can see, lies more lateral to the carotid artery. Comparing that to the femoral vein, the femoral vein lies more medial to the femoral artery. This will be more important when you are doing your ultrasound to judge which is the artery and which is the vein. This is an aid plus the features that I believe were mentioned by Dr. Talag in his ultrasound lecture. Okay, uh, we come to the technique part. Before we go to the steps of the insertion of a central line, uh, there are few points, including the consent and explanations of the procedure to the patient if he is awake. And you need to minimize the staff exposure, especially in the era of COVID-19. And you need to prepare yourself, including the personal protective equipment, your CV line kit, the 1% lidocaine, chlorhexidine, and the sleeve for the ultrasound probe. Okay, the technique. These are the major steps that you need to know, starting from sterilizing the site of insertion, followed by the draping the patient fully, and then you freeze the skin with a local anesthetic, and then you will insert your needle. After insertion of the needle, you will thread your guide wire through that needle. If everything going smoothly, you just need to remove the needle out and then insert the dilator over the guide wire. Do you do the dilatations? Once you are happy with the dilatation, remove the dilators, and the final step, insert your catheter. Okay, and now we will go in more detail about these steps. I would prefer that you will arrange your central line kit over a table, use alcohol wipes, wipe the whole table, put a sterile drape, and take the central line kit and then empty the central line kit over that table. When you have, you will face a different types of a central line depending on the company. What we have here in our department is the Aero company, and the usual size that we are using is 7 French 20 centimeter, which is a pressure injectable multi-lumen central venous catheter. If you see at the right side, this is a different company, but it has all the equipment that you need to insert a central line. Okay, once you open the kit, this is what you are expected to see. Empty all these over the table, and you will have 3 different sizes of syringes, one for the local anesthesia and one for the flushing, and the blue one for inserting the needle and to insert your guide wire through that needle. You will have a guide wire, you will have your catheter, scalpel, a dilator, suture size 30 silk with a straight needle. You will have the blue caps, as well as the butterfly clip or fixator. Okay, your kit is ready, your table is ready. You need to prepare yourself with the PPEs, including a head cap, a face shield or goggles, N95 or PAPR. You should wear initially the yellow gown or the isolation gown, and over that yellow gown you should wear your surgical gown. The sterile gloves, of course, and the shoes cover. Okay, with this video we'll go step by step from the sterilizations of the skin till the insertions of the catheter. Here we go. With internal jugular, you need to position your patients in a Trendelenburg position, like 10 to 15 degrees. Ask him to turn his chin to the opposite side, and with the help of the ultrasound, try to locate your vein so you can do the freezing and just to have a quick examinations of the targeted vein. Clean the area with the chlorhexidine and let it dries. Apply the drape all over the patients, and if the patient is awake, you can talk to him and explain the procedure or the next step of the procedure. Check your guide wire and flush your catheter with a 0.9 normal saline. It should be a sterile normal saline, of course. Once everything is ready, put a sleeve over the ultrasound probe with the help of another healthcare worker. Do the freezing with the local anesthetic, and with your inserting needle at a 45 degree along the directions of the vein, and with the help of the ultrasound, apply negative pressures while you are inserting your needle till you hit the vein. Once you hit the vein, there will be a backflow. Sometimes you will lose the backflow, and this is probably due to that you have punctured the posterior wall of the vein. Just go back and apply a negative pressure till you have your backflow again. Take the syringe out, and you will notice a nice dark non-pulsatile flow, which gives you a suggestions that you are in the vein. Now insert or thread your guide wire through the needle slowly. It should be easy and smooth. If you face resistance, please repeat the previous step. Insert the guide wire. Once you have, sometimes you will have arrhythmia if you insert the whole guide wire in. You need to pull it out and the arrhythmia will go away. Once you are sure the guide wire is in, take your needle out and with the scalpel make a skin cut to allow the dilator to go through that hole. Now use the dilator through the guide wire down to the skin hole. Apply a little bit force with the dilator. Twist the dilator in and push it inside to dilate the skin and the underneath subcutaneous tissues. Once you are happy with the dilatation, take the dilator out, and sometimes you can apply some gauze from the bleeding site just to control the bleeding. And now insert your catheter. Make sure to grab the guide wire and not to lose it with the non-dependent hand. Push the guide wire a little bit out till you see the other end coming out from the hub of the catheter. Once you see the guide wire out, you should grab the guide wire from the other end and push the catheter all the way down to the vein. And from now, the steps will be more easy for you because the line is in. There are 3 things you need to do. 1 is to flush your catheter. And check the inflow and the backflow. Close it with the blue caps, suture it, and then apply the dressing. Okay. I will give you a few tips about the insertion. The first one, your direction of the needle should be equal to the direction of the vein. And this must be a rule, even if we are using the ultrasound. Actually, with the ultrasound, it will be more easy for you because you can direct your needle exactly with the direction of the vein if you use a longitudinal view. The second tip is the skin bridge. What I mean with the skin bridge, when you do the skin cut with a scalpel to allow your dilator to go in, sometimes you don't cut the skin the whole way down to the puncture of the needle, which creates a skin bridge as it is showing here with a black arrow. The problem with that, whenever you insert a needle with the presence of this skin bridge, you will push the dilator against that skin, and this will destroy the tip of the dilator, and eventually it will kink your guide wire. What do you need to do? Just cut down again the skin bridge. How do you check for a skin bridge? At the left side, there is a quick video to see exactly how to check it. Do a circular movement around the insertion side. If there is a skin bridge, your guide wire will not reach the skin cut part. But if your skin cut is sufficient, then the whole guide wire will go down from the puncture site up to the skin cut. The third tip, the direction of the dilator should be equal to the direction of the wire, which means if you angulate your dilator up or down against the direction of the guide wire, this will result in kinking of your guide wire and subsequent problems with the insertions of the catheter. The fourth one, the pull and push of the guide wire. When you insert your dilator inside the skin, make sure you are pulling the guide wire back and forth every time you are inserting the dilator in. So for each 1 centimeter you are inserting the dilator in, check the guide wire back and forth to make sure that the guide wire is not kinked, as shown in this video. I'm going inside and then back and forth. I will go 1 more centimeter, check my guide wire again. It should be smooth without any problem. The fifth one, how far you will go with your catheter. In general, for the right-sided internal jugular vein, you should go around 15 centimeters. Over the left internal jugular vein, you should go around 17 or 18 centimeters. These green and yellow butterfly-shaped clips, they are used to determine exactly the length that you want and to fix that butterfly with a suture to the skin. You just clip it over each other and just put it to the length that you want. One more thing, the ultrasound is very helpful to make sure that your guide wire is inside the vein. So another tip, once you have sure that the guide wire is in the vein, don't take the needle out, keep everything the same, use the ultrasound probe, scan the vein again, make sure that the guide wire is going down from the skin to the subcutaneous tissues down to the vein. And this is another confirmatory way telling you that the guide wire is in the vein and not in the artery. Last part is the central line care. You need to apply sterile dressing before removing the sterile field. And number two, always access the line under sterile and clean conditions with alcohol-based solutions, meaning cleaning your hands with uh, with alcohol-based solutions, wear sterile gloves before you uh, access that line. And you need to reassess the daily need of that central line uh, because prolonged use of the central line will increase the risk of infection. Thank you, and I hope this video will be helpful for you, and I wish you the best of luck. Thanks.